So now what we're going to do, we're going to review some billing reports that can help with the review of your billing. So under the administration panel, and if you expand billing, there is this feature, it's called Edit Invoices. I like this here because you can select which billing provider, you can add a start and end date, you can add a demographic number, but I'll show you a more efficient way to look up like physician level bills. And then if you are working in a clinic that has multiple facility numbers, you can also filter by facility number. Additionally, you have all of the different claim statuses that you can filter on. So for this demo, I'm going to do all. I'm going to do for me, and let's just do the last 2 months here. And then I'm going to do click generate report. So what this report will show me is all of the claims that were created with all of the different statuses, because I did it for all. It will show the quantity, which might be helpful, especially for, those time codes. This could be a good review. So if you want to like review your time codes between the certain time frame, then you would have quantity, the amount, paid, et cetera, et cetera. And then if you scroll down to the bottom, you're going to see the total amounts and the count of claims. If we were to change it to rejected, this would be a good way to review your rejected codes as well. I do not have, we should have prefaced this, but in our sandbox, this is a test environment, so there's no connection to Teleplan, so we can't create any test like rejected claims. But in your system, you would be able to review any rejections in this way. And let's just pretend like these are rejected, not submitted. But if they had a rejection, you could click on edit message, and then you will be able to see the explanatory codes or the rejection codes at the top here. One status that I didn't realize, and in all fairness, we don't really touch billing supports that often, but I think it's key to highlight here is this status, paid with exception. This is an interesting status because that could be some claims that either got adjusted. So either like your current EMR didn't have the updated fee amount, so then Teleplan just adjusted the amount, or it could be some odd adjustments where there's less that got paid. So as a clinic, it would be really good to keep your eyes on paid with exception and also your rejection. If you're wanting to review rejections, also review your paid with exceptions as well. Now, my only qualm with this edit invoice report is that I wish that it had an opportunity to scope down to service code. And this is why we're going to jump to report by templates in a moment, because ideally it would be awesome if I wanted to look just at all my time codes between a set time frame. So we do have an ability to do that. It's just not within the constraints of this edit invoice report. It's through report by templates. But before we go into report by templates, we're going to pause and we're going to go and see how you can look at a similar view, but at a patient level. So I'm just going to go back to my schedule view. If I go to my master demographic record, I can see this patient's billing history. I'm going to do invoice list. And this is basically the exact same report, but now it's been filtered for that specific patient. So you can either, again, same thing, review rejected or any of the statuses and either all providers or yourself.